Okay, I'll do a little bit of housekeeping before I actually start the webinar. Again, I want to thank you for taking your time today to tune in. My name is David Kunashko. I'm the medical director at BIOFLEX Laser Therapy based out of Toronto, Ontario, Canada. I'm a chiropractor and TCM acupuncturist by profession. I've been practicing for over 30 years and in the capacity of laser therapy for over a decade now. And my background prior to that is in molecular biology, molecular genetics at the University of Toronto, where I did undergraduate work and graduate work. So my interest revolves around using laser therapy in clinical practice, and specifically around how the science actually works and what the science says. I try and keep these lectures and these webinars entertaining, I hope, but also informative and based on science, not on just someone saying something, which unfortunately there's a lot of misinformation, or I would just say out and outright lies by many manufacturers and devices out there, which is unfortunate, and it leads to a lot of misunderstanding. So part of my job is to try and clear that up. Hopefully you can appreciate that. So these webinars are always recorded, and if you want to watch a webinar, you can't attend, just register, and then you'll be sent a link to watch the recorded webinar via YouTube once we edit it and send it back out, which is usually within a week or so of the original broadcast date, okay? If you have any questions, I'd love to hear your questions as we go along. I'll probably answer them at the end, just because I want to get through the content. But you can ask your questions in the Q&A box. If you'd like to chat amongst yourselves, that kind of thing, that's what the chat function is for. Again, if you haven't, let me know your name if you'd like to. You don't have to. Let me know your name, where you're from geographically. It looks like we have people from, Canada and United States, from Quebec, and well, Quebec's part of Canada, right? and different states, Texas and Tennessee, and so forth, the United States as well. So what I'd like to do today is talk a little bit about the wavelengths used in laser therapy and why they're used. And then obviously I'm going to focus on red and why red is really important, but it can be used in different ways, a little bit different than near infrared wavelengths. So along with that, I'll talk about the depth of penetration based on science and research, not random facts people put out there, and the research that talks about that. And then I'll specifically talk about analgesia, or creating pain relief using red wavelengths. And that's a little bit different than you may be used to. And certainly how you use it is different. And then I'll talk about how you would specifically use the red laser probe for analgesia, and then why you'd be using the red laser probe for other conditions other than analgesia, and then Q&A. So let me know any questions, type them in as you go along. I will be more than happy to answer those as well. So BIOFLEX manufacturers, and we're a company, we've been around for 30 years, and we make professional equipment and we make consumer level equipment. When I talk about laser probes, these tend to be restricted devices to clinicians, or at least people that have had training to use them, that kind of scenario. And typically the standard laser probe is an infrared, and we have a LDI 200 milliwatts laser probe, and that's around 830 nanometers. That's near infrared. The power density, which is milliwatts per centimeter squared, is 2000. And that's because it's a pretty small surface area, 0.1 to 0.3 approximately elliptical surface area. So a lot of energy in a very small surface area gives you a pretty high energy density. And the red laser probe, and by the way, the infrared tends to be standard. Most people would get that with their system. And the red laser probe is one that is optional, and some of you may have it and many of you may not, or not understand why you would want it. So obviously today I'm going to talk more in depth about that, and specifically, it's 660 nanometers, that's red. It's about 1,000 milliwatts per centimeter squared power density. So we need to understand what it is light is doing, inside the cell and what we're trying to target, that kind of thing. And then, as you probably know, or if you're new to this, maybe you don't know, one of the main targets or photoacceptors lies within the mitochondria of cells. And when you look at the mitochondria and the membrane, the outer membrane, there are embedded enzymes that have to do with aerobic respiration or the generation of adenosine triphosphate, allowing the cell to function, right? That's why we breathe air, because it has oxygen. You need oxygen for aerobic respiration, right? And you need to eat because you need glucose, which is broken down by the Krebs cycle and feeds into the electron transport chain to energize ADP into ATP. So unfortunately, what happens in a lot of conditions, due to inflammation, that kind of scenario, the cells are inhibited, mainly due to a buildup of toxic byproducts, and one of which is nitric oxide. And it's really challenging sometimes to understand, and very complicated to understand, how some molecules in small concentrations are provide a positive effect, but as they get into higher concentrations, they have an inhibitory effect. And that's similar to what nitric oxide does. Nitric oxide has lots of beneficial aspects in cell function, but when the levels get too high, they outcompete oxygen in this electron transport chain in the mitochondria. And you can see here in the lower left, nitric oxide is bound to Cu, which is copper, in a photoacceptor called cytochrome C oxidase. When nitric oxide reaches high levels, it outcompetes oxygen and it inhibits aerobic respiration. That's not a good thing. So the cell can undergo what's called apoptosis, or triggered death, or it can become quiescent, or it doesn't function properly. So for cells to function properly, they need to undergo mitosis, regeneration, repair, that kind of scenario. When you have prolonged or you have inflammation, it kind of inhibits this process. The body is trying to clean it up and resolve inflammation, but the way we've been designed, or whoever designed us, aliens or whoever, whatever you believe in, probably along the lines of evolution. But anyway, what happens is, these cells need to function and they need to do certain things. And when it's inhibited, this leads to prolonged repair processes and prolonged inflammation and problems. When you add light therapy, especially red and near infrared, red is actually by far a much better wavelength, and I'll talk about that shortly. It actually breaks the hydrogen bond. So if you look closely at the bottom left is nitric oxide. That little dash represents a hydrogen bond. It's a weak bond, and it bonds to copper. The energy of red and near infrared is absorbed. Those wavelengths are absorbed by copper and actually iron, and breaks that hydrogen bond with the energy. So it's like a photonic or photochemical reaction. And when you break that bond, especially if you do it over a consistent time frame, that allows oxygen to bind back onto copper, which is what the diagram on the lower right is showing. Nitric oxide is freely diffusible through the membrane. It goes into your blood, causes vasodilation, it kind of dissociates. So if you bombard inflamed or injured tissues long enough, you'll actually get a therapeutic effect with the light. And that's what photobiomodulation is really based on. Now, I use the term photobiomodulation, and that's the technical term, but laser therapy is kind of what we all know about it. So the big picture here, and I won't go into a lot of depth because I've done this in many other webinars, end of the day, the light, these are the wavy red lines. When they enter the cells that are affected by inflammation or metabolic stress, it can have a trickle-down effect by increasing ATP production, and that leads to lots of other positive effects inside the cell, with the eventual outcome of increased mitotic index, so the cells can repair, regenerate more efficiently, and the cells start to protect themselves against further damage by making stress proteins. That's via ROS and nuclear factor kappa beta, which I will not get into today, but that's sort of what's happening inside the cell to some degree. Now, we need to understand, if we're talking about red wavelength and infrared wavelengths, we need to understand the concept of action spectrum, which is a graph which basically shows you the rate of physiological activity plotted against the wavelength. So in other words, chromophores or photoacceptors in the body absorb certain wavelengths and they activate them. And, these specific wavelengths will make this enzyme more active. And that's what we're referring to as an action spectrum. Okay. So it depends on the wavelength of light, but certain wavelengths can be more effective to cause this chemical reaction or photochemical reaction. An easiest way to really understand this concept is chlorophyll and photosynthesis. And we all know that, plants are green and they absorb, believe it or not, red and blue regions more than green. That's why they look green, because they reflect green, but they absorb red and blue. So it's red and blue, specifically wavelengths from the sun, that actually carry out photosynthesis. So if we look at the action spectrum graph of chlorophyll, you'll see it peaks in both blue and red, and it goes down or less absorbed by green. Okay, so this is an example of an action spectrum graph, and one we need to understand when we're talking about laser therapy. With respect to laser therapy, remember earlier I mentioned about this enzyme cytochrome C oxidase. Well, its action spectrum is different, obviously, than chlorophyll. And a lot of research has been done into determining what wavelengths activate this enzyme. You can see here copper, whether it's oxidized or in the reduced form, absorbs a lot of light in the red. That's 620, 680, or in between there, and near infrared 760 to 820, 30 nanometers. Those are the peaks of the wavelengths that are absorbed. So through science, believe it or not, we've been able to determine if you want to activate this enzyme, then red and near infrared wavelengths are good. Now, there's other wavelengths that are also really good, like blue and violet. You can see down here is also peaks of 400 nanometers, a little bit lower down. The problem with that is that those wavelengths are absorbed by other things. And I'll talk about that very shortly. So Tina Carew is the main researcher that sort of discovered all these, and she found 4 peaks or ranges that we know that are effective for laser therapy in the red and near infrared, as I've shown you here. Remember, I'm talking about red today, but I need to give you an understanding of what's going on here. So when we do the action spectrum for cytochrome C oxidase, remember, this is the enzyme that's critical. You can see here that green and yellow, and if you go a little bit farther, blue and violet can really actively activate this enzyme. And then you can see red is pretty decent, and it bottoms out at around 700 and then peaks up again in near infrared and then bottoms out again. So it's like, okay, those wavelengths seem to activate this enzyme. The problem with laser therapy is that there's blood, and lots of blood in us, because that's what we need. So blood absorbs many different wavelengths, especially hemoglobin. So it absorbs green and yellow and orange, a little bit of red, but then it starts to reflect red as well too. So if you want to use blue light, it's going to be absorbed almost all by hemoglobin. So blue light won't reach the tissues and the cells and the targets that you want, which is why blue light is effective on the surface of the skin, but not deeper down, because it doesn't penetrate because of the absorption by hemoglobin. Then you shift farther over, you can see that water starts to absorb a lot of wavelengths over 900 nanometers and into 1,000 nanometers. So really, the best wavelengths to use are red. You can see here, it gets that at that peak, and the activity of this enzyme is relatively high when you use red light. And there's a second peak, not quite as high, near infrared. Okay, so there's a window of wavelengths. So red is actually more effective than infrared for laser therapy. The reason why infrared is always used is because red doesn't go very deep. Infrared can go much deeper and therefore is of really good wavelength. And you might say, well, why even use red? That's the whole point of today's topic. Okay, so red light, again, remember, it's absorbed by lots of photoreceptors, even to some degree hemoglobin. And when it's absorbed in a sort of circular, spherical pattern shown on the bottom of your screen here. And the penetration depth is relatively shallow. Near infrared, the wavelengths we use are around 830, 840 nanometers, and that's pretty standard in the realm of photobiomodulation, is that these wavelengths are less absorbed by different molecules and therefore can sort of percolate and go deeper. The decreased scatter causes more of an elliptical penetration pattern shown on the right here. So you can imagine if you're using red, it goes in relatively superficial, spherical, and infrared kind of going deeper elliptical or elliptoid fashion into your body. So this chart here shows the comparison of cytochrome C oxidase absorption spectrum and cellular ATP content action spectrum. So basically all it's showing here is what I just showed you earlier, that cytochrome C oxidase will produce more ATP when it's absorbing certain wavelengths, including red and a second peak near infrared. Okay, so that's why you want to use these wavelengths. Now, there's been a lot of research on understanding, how light goes into the body, how it's absorbed. There's many factors, including density of tissue, skin color, blood perfusion, as I've just mentioned. Hair can get in the way, fat can get in the way, bone or whatever it is. So these are all governed and play into the fact of how light how far light can go into your body. So whenever someone calls me and says, well, how deep can your equipment go? And unfortunately, I hate to say it, it's an ignorant question because there is no one answer. And it's a good question, but it's a question that means you don't really understand the concept of the physics of light penetrating into tissue. There's no one answer. And no one has any patents on red light or infrared light. We just know from thousands of research papers and clinical trials and in vitro studies that these wavelengths will stimulate better than the other wavelengths. So when you look at the research shown, low near infrared around 800, this would be around 810, 820, 830, around that range, can penetrate several centimeters into the human body. Okay, and as you increase the wavelength, well, it doesn't go as deep because it's more absorbed by water. Now, if you look at red light, this specific paper looked at red light, and it shows it goes about 50 millimeters or about half a centimeter, so much more shallow. But 50 millimeters, you may think, oh, that's not very deep. It's actually pretty deep. You can get to many structures using just red light as well. And I'll talk about that. So you can get into past skin and into even muscles, tendons, or ligaments, and even some bone, depending where you are on the body. If you think about it right now, if you bend your elbow like this and touch your olecranon, the distance between where you're touching the skin and that bone, and by the way, there's a bursa between that and your bone, you can reach all that with red light, okay? So you can increase light irradiance, which is basically energy density. And this will kind of, increase the capacity for it to penetrate to some degree. But there's a limit to that. And, the reason why high powers aren't used is that it starts to heat up tissues, and that's what you don't want. It actually inhibits what you're trying to do, typically photobiomodulation. But if you use high energy densities for longer periods of time, you can achieve analgesia as well, or pain relief. So red light, as I mentioned, just as a recap, You can see here in millimeters, 0, 1, 2, 3, 4, 5 millimeters. It's going to go around 5 millimeters. You can see here ultraviolet, it's almost all absorbed by melanin, so it's not going very deep at all. Blue light, less than a millimeter. Green, a couple millimeters, if that. Yellow, not much deeper. So these wavelengths tend not to be used very well. Plus, they're actually not, they don't provide a lot of, especially yellow is not great for photobiomodulation. I'm going to talk a little bit now about using red light for analgesia. Now, analgesia, if you're using laser therapy, is a little bit different than photobiomodulation. Photobiomodulation is lower doses in order to stimulate healing and anti-inflammatory effects. When you're trying to induce analgesia, you're using much higher energy densities, upwards of 300 milliwatts per centimeter squared. Remember, ours are even much higher than that because of the small surface area. And these high energy densities are absorbed by pain receptors, nociceptors, and they can exert an inhibitory effect on these pain receptors, A and C pain fibers. So essentially what's happening is it slows the conduction velocity, reduces amplitude of what's called the action potentials, and it can suppress neurogenic inflammation. A lot of this research was done by Dr. Roberta Chow out of Australia. And she did some really amazing experiments, and they basically showed that this high power density of light, whether it's infrared or red, can actually block the anterograde, which is just forward movement of ATP in dorsal root ganglions. Essentially, all it's doing is blocking it. And I'm going to show you this effect. This blockage were called varicosities, and it's a temporary kind of scenario that's occurring. I guess it's pretty complex as to what's going on there. They're still not quite sure, but essentially it's interrupting the fast axonal flow, which reduces the availability of ATP for the resting potential, and therefore you'll get less pain sensation. The effect is completely reversible and may last up to 24 to 48 hours. Here's a little micrograph or electron micrograph showing the vesicle. This on the left, B is a nerve fiber axon, right? And when it was exposed, in this case, it was infrared, but similarly with red light, after 30 seconds, you can see it bulges out, and that's that vesicle, that blockage that's formed to block pain transmission. This is just a little photomicrograph, I guess, video micrograph of showing anterograde flow of mitochondria down an axon. So that's what's being blocked when you use high density light on axons. And remember, a lot of nociceptors are found superficially in your skin, and that's why red light can be really effective to help block pain. In this particular paper, they talk about the analgesic action of low-level laser therapy. That's the old term, of course. Now, this was in animal models, and they looked at both infrared and red. So 830 nanometers infrared, 660 nanometers red. Now, we use both of those in our equipment, and both on LED form and laser form. And essentially, they use mouse models. I won't get into all the details, but what they found was that obviously laser therapy ended up having an analgesic effect, but that red laser had better results. And the reason for that is the red light accumulates to a higher density superficially in the skin. In this case, it did the paw of the rats. And we know that if you target the superficial nociceptors over an area that's painful, you can achieve some pain relief. So that's what they were trying to do in this specific experiment. Another experiment by Roberta Chow was implications for anesthesia and pain relief. And what I really want to show you here is that if you look at, this was a cross-section of skin, and they stained it so that you can see different components. The blue area is the epidermis, pretty thin. You see the basement membrane in red of the skin. And then you can see embedded, these sort of squiggly lines are nociceptor pain fibers, all throughout this relatively superficial area of the skin. That's the target for analgesia. So Dr. Ho, I'm sure everyone knows, TENS machine, they work by blocking these pain fibers in the surface of the skin. Okay, so TENS is one mechanism used to temporarily block pain. The problem with TENS, not the problem, and it's fine, it gives you temporary relief. That's all it can do. It doesn't really provide any healing effect. But when you combine photobiomodulation and high-powered intensity, you can achieve pain relief and healing, which is what TENS can't do. And also, TENS can be accommodated relatively quickly and easily by the body and will be less effective. This is not accommodated for. The effect will always be established if you use the correct dosages. Okay, so how are you going to use our equipment? I guess that's why you tuned in, right? So what we need to understand is for analgesia, you need to have the correct dosage. Remember, power in watts times time in seconds gives you 1 joule of energy. At 100 milliwatts, multiplied by 10 seconds, you're looking at 1 joule. At 150 seconds, you're looking at 15 joules. And that's about the sweet spot for analgesia. Anywhere between 50 and 20 joules per point is going to give you pretty profound analgesia over an area. That would mean holding a 100 milliwatt laser probe, which is what ours is at, for upwards of 150 seconds to 200 seconds. That's a long time, granted, but your goal isn't to provide low energy. Your goal is to provide high energy, relatively superficial, to help block pain. So this is handy where someone's in a lot of pain and you just want to kind of zap them and get some pain relief. What I would first do, though, is your regular photobiomodulation techniques, which is providing lower energy deeper to the tissues for healing for whatever the problem may be. And then you can use the red laser probe at the end to provide an analgesic effect. And remember, it's being contained relatively superficially, so you won't be overdosing the deeper tissues, which is why I recommend infrared for analgesia as opposed to near infrared, because if you use near infrared, you can achieve analgesia, but you're also treating a lot of the deeper structures with tons of energy, and that's going to inhibit photobiomodulation. So that's why I think it's a good combination to do that. So when you want to induce analgesia with an LDR-100 laser probe, you want to target the most painful area, hold the tip of the probe firmly against the tissues for anywhere from 2.5 to 3 minutes per point. You may choose to do 1, 2, or 3 points or what have you. In that range is good, and this will help with analgesia. Remember, even though this seems like a long time, the goal isn't for healing. The goal is just temporary blockage of pain here. So it's going to try and induce analgesia via these mechanisms I described earlier. I'm mentioning this because, sometimes you just want to help a person with pain immediately, and I understand that. But one of the main goals of using red light is for healing, and so I'll talk about that as well. So for healing, remember the penetration depth is about 5 millimeters or so, right? Give or take, but that's about it. Light's not going much, red light's not going much deeper than that, maybe another millimeter or two, whatever, but not a whole lot deeper. So red wavelengths will concentrate fairly well on superficial tissues and therefore are effective for a fairly wide range of conditions within this range of depth of penetration, including wound healing at the surface of the skin and the wound bed, scar tissue modulation. So we've done a lot of this work in our clinic, and we have protocols to reduce keloid scars, reduce scar tissue. Of course, it works best if you do it right when the wound is healing, but you can also do it post healing of a wound as well to reduce the volume of scar tissue by modulating the fibroblasts. There, you don't want to overdose. You want to create a proper dose in those tissues, and I'll mention what that dosage is shortly. Cosmetic aging of the skin, fine lines and wrinkles as well. Really great to use red light because it's concentrated in the skin, which is going to modulate fibroblasts and help them regenerate, help them produce more collagen, and make the skin healthier. For that, you need lower doses, not those high doses for analgesia. For acne, if you treat acne, again, red is great because it's going to get a lot of the bacteria. It actually has it's bactericidal properties, or antibacterial, same thing, at the surface of the skin. Now, you'd also use infrared because that's going to go deeper into the acne area as well. But red will be wonderful for helping to decrease that bacterial count as well. Hair growth, and I think I have a webinar posted on hair growth. You can help hair follicles that are stuck in their growth phase, especially due to different types of androgenic or alopecia, or different types of hormone-induced alopecia, secondary to medications, chemotherapy, that kind of thing. It's very helpful. Think about this: superficial bursae over the olecranon, over the trochanter in the hip. You can actually get at, if you push the probe into the trochanter, you can get light directly into that bursa. Over the calcaneus, you can get light directly into that bursa using red light. Over the prepatellar region, you can get light directly into that bursa, and it accumulates in there to give you a nice anti-inflammatory effect. The TMJ is relatively superficial. So temporomandibular disorders using red light, both for analgesia, but also getting the light into the joint, can be very beneficial. If you're treating arthritis in the fingers and the toes, using red light all the way around the circumference of the joint will get light through the skin and into the actual joint itself and the synovial lining, especially to reduce edema and inflammation. And wrist, similarly, relatively superficial. The wrist joints, not all the way down into the wrist joint, I get that, but on the most superficial aspect of the joints in the synovium, you can get light into those joints. So it's helpful for sprains and arthritis. And any superficial tendon, for example, a de Quervain's, you can get light right up and down the length of that tendon by using the red laser probe as well. So for healing or photobiomodulation effects, the dosage is going to be much lower. For about 10 seconds at 100 milliwatts, we're looking at 1 joule. For healing, we're looking at about 4 joules or thereabouts. You can start with 10, 20 seconds, but maybe work your way up to 30, 40 seconds per point in order to establish healing effects using the red light. Okay, so that's it for the info. I hope that you found it useful. If you have follow-up questions, I see there's a few. I'll answer them right now. Before I get to those, we do have a few upcoming webinars. The next one is on using the personal system for menstrual cramps and pain. It can be quite effective for that. And the second one is designed more for chiropractors. If you know any chiros out there interested in using laser therapy, I appreciate the referral. If maybe they want to tune in and find a little bit more about why that might be helpful in their practice. And as I mentioned earlier, on November the 12th, if you happen to be in the Greater Toronto area, we're hosting a live event, an all-day event up in King City at the Kingbridge Center. I think the early bird is still in effect at $99. It gives you a nice gourmet lunch and a chance to listen live to Dr. Ben Ewan from Halifax, Dr. Randy Santiago, our clinical research director. We just actually had a paper published today, in fact, on scar tissue and neuroinflammation. So I can share that. We'll hopefully get on our website and I can share that with you as well. But if you'd like to contact me, I can get that paper to you directly. So just go to our website and you can and find the details about this event as well. You can always contact me on my email at david@bioflexlaser.com. So let me look at some of the questions here I have. Oh, so yeah. So I did say 50 millimeters, which is 5 centimeters, but um, the way, and yeah, good point and good catch there, Mike, is that 50 millimeters is 5 centimeters. That's not the effective depth of penetration. So when you're talking about the depth of penetration that red light can actually achieve an effect is around 5 millimeters. You'll detect some photons of red light up to that depth, depending on the tissue integrity or tissue density, but the actual ability for that light to achieve a reaction is limited to about 5 millimeters. Okay, a question from Max from France. Oh, thanks for listening all the way from France. If I understood you right, red light goes 5 millimeters deep into the skin. If the area you want to treat is deeper, it's useless. Well, no, actually, that's not correct, Max. Red light also affects blood. And especially white blood cells and platelets and stem cells. So a big part of the treatment that we use with red light for our large surface LEDs is to irradiate circulating blood that immunomodulates white blood cells and platelets and stem cells. And it will have a remote or systemic effect to the deeper areas of the body. So using red light is actually really beneficial, not just for superficial conditions, but if you treat the tissue longer, like minutes, which is what we do with our large array of light, then you can achieve a remote or systemic effect. Max, if you'd like more information on that, I've done several webinars on that. You can reach out to me and I can send you some of those webinars so you can understand about the systemic or remote effect. A question here, if you're doing a protocol, say shoulder or knee, should we do the array placements then when it's time for the probe, connect both the red and infrared probe simultaneously to get the healing and analgesia together? Yes, you can actually do that, Riz. You can use red and infrared together simultaneously. The infrared is going to be penetrating much deeper. You would be using that for less. Your standard 3-4 seconds up to 10, 15, 20, 30 seconds, and the red probe in the range, like I said, of at least 10 seconds, but probably more 20, 30 plus seconds for analgesia. Question here from Max, what advantage your 30 years of experience in this field gives you over your competitors? Well, so I'll say a couple of things. Those of you who don't have BIOFLEX, I've used different laser therapy equipment, and I'm not going to, say they're all inferior or what have you. There's just some critical differences between our equipment and competitors. One is that we combine a large surface arrays of high-powered LEDs to promote a systemic or remote effect, which I just alluded to earlier, along with class 3B lasers, which I've shown you here. But more importantly, we've been using this equipment in our laser clinic for 30 years under Dr. Fred Kahn. He passed away last year, actually. So our company's founded on clinical applications using it in our clinic and worldwide. So from that data and ongoing research, we've established parameters or ranges that we know are effective. And really that has to do with our clinical know-how and using it as opposed to a manufacturer. I mean, you can list a whole bunch of manufacturers you want, Max, and I'll tell you all of them, they're not clinically based. They make stuff and they sell it to you. They may have an expert or two, but they don't use it in a clinic like we do, and they don't have a clinical background. So we have multiple doctors available for clinical support for using our equipment, and that would also, make us a little bit different than the competition as well. That's it. Thanks so much for tuning in today. If you have any further questions, you can certainly reach out to me at david@bioflexlaser.com. I do really appreciate your time today. A quick question here for wrinkles. Would you use the red array or red probe? To be honest, for wrinkles, I would probably use the red array, just because you can have it on the tissue for longer, which gives you the similar dosaging, but you can have it on longer and it's going to concentrate into the skin. Same for hair growth as well too. But if there's just a small area you want to do, certain areas of wrinkles, the array might be overkill. So then you can use the red laser probe on those points as well. So it just depends on if it's a larger area of wrinkled area you want to treat or a smaller area. Okay, thanks again. I appreciate everyone's time today. Take care.